Welcome to the Red Light Therapy Podcast, brought to you by Platinum LED Therapy Lights, the pioneers who spent 15 years building the world's most powerful red light technology. In each episode, we show you how to use that power to heal your body, save time with shorter sessions, and get the professional-grade results you deserve. This is the science of the light, simplified for you. And now, your host, Mike Volkin.
Thank you for joining us, everybody. Today, our co-host is longevity and sports performance specialist from West Texas, Dr. Alan Inman. Welcome to the show, Dr. Inman.
It's a wonderful chance to be here again and speak of, red light therapy that's so important for all of our health.
There's endless amount of topics. Today, we have a good one for all the listeners. Dr. Inman, by the way, has 2 clinics in Costa Rica and is a medical director of a stem cell clinic, to which I am a proud customer of. It just got stem cell therapy and it went great. As a red light therapy expert, he will be sharing his wisdom so you can make the most out of your red light therapy device. Each episode is designed to be very bite-sized, 15 minutes or less, so you can listen on your way to work or even during one of your red light therapy sessions. Today, we're going to continue on with our Foundation in Performance series, and the main topic today is stopping the ache, managing daily pain without pills. So are you ready to dive in and have me fire off some questions for you?
I'm ready.
Okay.
Let's go.
By the way, all you listeners out there, redlighttherapypodcast.com. Submit any questions you have. First question for you, Dr. Inman. How does near infrared light reach deep into sore joints?
Well, we need to look at the fact that when we're comparing it with just the red light will be more superficial and it's, towards the layers of the skin. And when we're looking at this near infrared, which is, that wavelength between 810 and 880 nanometers, we're going to find that it goes, centimeters deep. We're going to find that it's going to affect muscles, tendons, ligaments, and, it'll even reach those joints. Once it reaches these tissues, it's going to help the mitochondria to be able to produce more energy so that we can, at the end of the day, have more repair, which is what we're all looking for. And it's also going to improve microcirculation and reduce inflammatory signaling, which are the 2 major contributors to chronic joint pain. And I'm going to give you an example. I think this is really important that all listeners are listening to this, because the creator of this line, Platinum LED, he had his own incident. And we know that he had a skiing accident and his knee swelled up big time, up to 2 to 3 times the normal size. And he had heard that red lights could help. And he wasn't really sure if this could occur. So he said, I'm going to try this out. I know that since 1983, NASA had, discovered what is red light therapy, but in the context of swelling, he thought, let's try it out. So he put red light therapy on the front and back side, 30 minutes and 30 minutes. And then he stood up after not being able to move it, not even a millimeter in any direction because there was so much pain. And he was able to do a squat. And so it blew his mind. And from there on out, more than 15 years ago, he goes, okay, now I'm addicted to this. Now I got to help people. And this has been his life mission. And so we know that red light therapy has the capacity of going deep into the joint, decreasing what is this inflammation through increasing the mitochondrial function.
Yep, I've heard that story before, and it is the spawn of a generation of the most premium red light therapy panels. You got all these copycats out there, but honestly, the leader, there's a reason why Platinum is like that, is because of that story that the founder has to believe in the product. It's not just something you order from a warehouse to try to sell. He's tinkering with the product and he's making it premium for a reason. So you talked about old injuries, chronic injuries. Can red light therapy help with old injuries that just won't go away?
Yes, and this is one of the most common reasons people use photobiomodulation. So old injuries will often persist because the tissues get stuck in low-grade inflammatory state. What does that mean? Is that because it's chronic and it's persistent and it's still there, then all of a sudden the mitochondria doesn't have the capacity to produce the energy so we can regenerate those tissues. So that light will penetrate, it'll reach the mitochondria, displace nitric oxide from that enzyme, cytochrome C oxidase, that I've spoken of in other podcasts. And we know that at the end of the day, when that oxygen reaches there, we'll have energy, ATP. So at the end, we'll increase mitochondrial function, we'll have improved circulation in poorly healing tissues. We also know that it's going to stimulate what is cellular repair mechanisms, so we can repair those tissues, and it's going to reduce this chronic inflammatory cytokines. So what is that? Inside, we're going to find that there are just different components which keep stimulating this inflammation. So it's going to reduce it. So thus, we have that we can, in the end, grab this stalled tissue that is not healing and allow it to heal, which is what we want.
And folks, this is not just Dr. Inman making stuff up. This is like backed by science, lots of studies, meta studies, independent research, third-party studies. I mean, this is all proven science. How long does a pain relief effect usually last?
This is a really important question. When we're speaking of someone who's got acute pain and they use it, it can last a few hours. And then if you have someone who has chronic pain and they just keep using it, well, obviously the pain is going to reduce for more time. But we have to look at it into this context. What is it doing in the end of the day? By having more energy and by repairing, it's not just getting the inflammation out for a little while. It's so that the inflammation goes away forever. Because if you can repair the tissue, then you shouldn't have inflammation anymore, which is what we're trying to accomplish. So when people want an exact time, there's no way of doing that. It just takes the amount of time it takes to repair that tissue will then determine at the end how long it took to decrease in that inflammation so you don't have it anymore.
That makes sense. So is red light better for sharp pain or dull chronic aches?
Let's look at it like this. Both red light and this near infrared light therapy is going to be useful in the depth in which that tissue will have this inflammation. So that type of different, dull chronic and sharp pain, it won't really differentiate. It just depends on how deep it is. So if we're looking at it, it's going to help us from the skin. It's going to help with the superficial muscle. It's going to be able to help with tendons, ligaments, joints. And so it just depends what we're trying to accomplish in the depth and where that pain is found. Okay. But it'll help both. I'm just saying, to be able to precisely say which it'll help with the most, it doesn't have to do with that. It just has to do with depth.
Okay, so I have full body panels myself. Can I use this for my back, my knees, and neck, like all in one day, or do I target one particular area? What's the right answer there?
I would put it like this. Since these type of panels are so incredible because they have different wavelengths, then you can do it all together. So you might as well tack everything at once and get it out of the way and not just go, well, I just want this area.
Yeah. Wow. What other, this isn't really a question, it's more of a thought. It's like, what other non-invasive medical treatment can you get that would help with multiple injuries at one time? It's pretty incredible how just even comfortable light would do something like that. So does it help with nerve related pain specifically?
Oh yeah, it really can. It can help repair nerves that are damaged because they also have dysfunction in mitochondria when there's chronic inflammation. And so it's really important to know that when we're placing red light therapy over these areas, it's going to affect nerves and all the other tissues. So a lot of us are stuck with pain in these nerves. And so even though the inflammation in the area or the zone that had been there has, left, we're left still with nerves that are inflamed. And there are multiple examples of this, and one of them is like a neuroma. So that's inflammation of a nerve. And what happens is it'll help in these areas so that there is nerve repair. By having more energy, they're capable of doing that. So we have to always look at red light therapy gives you more energy so that at the end of the day, you get more repair. So it's going to reduce neuroinflammation. It's going to improve local blood flow to the nerves. And on top of that, we're going to be able to support nerve regeneration like I had spoken. So you have conditions like neuropathic pain, or you have nerve compression syndromes or peripheral nerve injuries. It's going to help us with that. And a lot of us are suffering of these conditions and may not even know it. So just by using red light therapy and all of a sudden these conditions go away, we may have never known that was one of these primary conditions that we had.
That's very true. One last question for this episode. This is a common question we get at the customer service center is it safe to use red light therapy while taking over-the-counter pain meds like your ibuprofens and your Tylenols of the world? Is it safe to do that?
Yes, generally it's safe. When we look at light therapy, it works through cellular metabolic pathways, while over-the-counter, medication like acetaminophen or ibuprofen work through biochemical inhibition of inflammatory mediators. So at the end of the day, there are two different pathways. It's not going to interrupt. If anything, it's going to help. And what I always say at the end of the day, let's try to find a way that's more natural and that keeps us from having to depend on meds. And that's what red light therapy can do. So we also know that there are various, veterans out there who have red light therapy to help them so that they don't have to keep taking medication. None of us want to have side effects. So yeah, the idea is, yes, you can do it, but as you use them, it can probably help us transition out of it. Because if we look at whole body pain syndrome, let's give you an example. Fibromyalgia, after using 4 weeks of red light therapy, the pain intensity has decreased 35 to 40%. That's a lot. When people need this, they see how much it can help them so that they don't use meds. Or like neuropathic pain, photobiomodulation has reduced it from 30 to 50% in medical studies.
Wow.
Or if we look at pain in the fact that, people have muscle soreness after they work out and then they pop a pill to remove it. Well, if you use red light therapy, that there was a study with 46 different studies in sports medicine, they found that muscle soreness reduced from 25 to 50% after using red light therapy. So it's really important to know these studies, because when we do, then we know that there are alternatives that keep us away from it.
That's right. That's the biggest benefit I get out of my daily red light therapy treatment is the reduced soreness. I definitely notice that after a tennis match. So Dr. Inman, again, invaluable. Thank you so much for your help, and we look forward to having you on future episodes. Thanks again.
Thank you. And I hope everyone has a blessed day.
Thank you. And follow us on redlighttherapypodcast.com and subscribe to us on YouTube. Thanks, everybody, for listening.
Thank you for joining us on the Red Light Therapy Podcast. While others imitate, Platinum innovates. For over 15 years, Platinum Therapy Lights remains the pioneers and global leader in the red light therapy industry. Access the same technology trusted by medical professionals, researchers, and peak performers worldwide. Now, it is your turn to experience the Platinum LED difference. Visit PlatinumTherapyLights.com to secure your professional-grade results today.